Today, we're jumping straight into a really interesting comparison looking at how we treat Pilonidal Sinus Disease, or PSD.
Right, that often painful condition, usually affecting younger men, that's traditionally meant some pretty involved surgery.
Exactly. And this deep dive, it's actually based on a very perspicacious review by Dr. Reza Lankarani. He's a general surgeon, founder of the Surgical Pioneering newsletter and podcast series, and also on the editorial board for the Genesis Journal of Surgery and Medicine.
A solid source for this kind of analysis.
Definitely. So our mission today is to quickly unpack a study, a retrospective one, with 288 patients. It compares laser ablation, the newer technique, against two, let's call them conventional surgery.
Yes, the direct closure, or DC, and flap closure, FC. Basically, stitching it closed directly versus using nearby tissue.
And both of those older methods, they often come with significant downtime, don't they?
That's the traditional picture, yes.
Yeah.
Significant recovery.
Okay, so let's get into it. The big appeal for things like laser ablation is often speed, right? Faster recovery, less trauma.
That's the promise, absolutely. Less invasive should mean quicker healing.
So how did that actually play out in the study? What were the real-world metrics? Time savings, getting back to life?
The differences were, well, pretty dramatic. Operation time, for instance. Laser ablation averaged just 18.2 minutes.
18 minutes, that's fast compared to
Almost 34 minutes for direct closure and nearly an hour, 59.5 minutes for the flap closure.
Wow, okay. Big difference there.
And it gets better. 94% of those laser procedures done as day surgery, outpatient.
So in and out the same day, mostly.
Mostly, yes. And think about sick leave. This is huge for the patient. Laser group needed an average of just 7.1 days off.
Only a week.
Only about a week. Compare that to almost 26 days for DC and over 31 days a full month for efficacy.
That's a massive difference in lost time, lost wages, disruption.
Exactly. And one more thing, the sitting restriction. Awful for PSD patients.
Right.
With laser, it was practically nothing. 0.1 weeks, so maybe a day or so, versus over 2 weeks for DC and over 3 weeks for FC.
Okay, so the immediate benefits, the speed, the recovery, they seem undeniable. But you always wonder, is there a trade-off? Does faster mean less effective, maybe?
That's always the critical question with minimally invasive approaches. So let's look at the outcomes. Eventless healing, that's the goal, right? No problems, no recurrence, nothing left behind.
How did laser stack up there?
Actually, pretty well. Similar rates for laser, about 68%, and direct closure, around 66%. So comparable success in terms of perfect healing initially.
Okay, parity there. What about the risks? Complications?
This is where laser really stood out. The overall complication rate was way lower, about 13% for laser.
Compared to
Nearly 28% for DC and almost 35% for FC. And crucially,
yes.
things like hematoma, significant bruising or blood collection, and wound dehiscence, where the wound splits open.
Oh, nasty stuff.
Very. Those happen only in the conventional surgery groups, none in the laser group.
So you dramatically cut the risk of those major wound issues. That's a significant safety benefit.
It really is. But there's always a but, isn't there?
Uh-oh. The flip side.
A flip side. Remember we talked about potential trade-offs? Residual disease, meaning some diseased tissue possibly left behind, checked within the first 2 months. That was highest in the laser group.
How high?
About 26%. Compared to only 8 or 9% for the other two groups. It's a known limitation, potentially, of being less invasive. You might not clear everything out quite as aggressively.
Okay, so a higher chance of needing something else done soon after.
Potentially, yes. That's the implication. But interestingly,
What?
when they looked at recurrence after those first 2 months, the rate was actually lowest in the laser group, only 3.6%.
Lowest. Despite the higher initial residual rate. That seems counterintuitive.
It does, but here's the major caveat, and it's important. The follow-up time for the laser group was much shorter. On average, only about 14 months.
And for the others?
Over 80 months. More like 6 or 7 years of follow-up data.
Right. So we just don't have the same long-term picture for laser recurrence yet.
Exactly. The short-term data looks good on recurrence, but we need more time to say definitively how it compares over, say, 5 or 10 years.
Okay, so wrapping this up, for you, the listener, what's the core finding here? It sounds like laser ablation really shines as maybe a first-line option, especially prioritizing that quick recovery, fewer major complications.
That seems to be the takeaway, yes. It's safe, it's effective, and it gets people back to their lives incredibly quickly, which is often paramount for that younger demographic most affected by PSD.
It dramatically reduces that immediate burden of surgery.
Absolutely. But, and this is the final thought to maybe chew on, the study itself, despite the positive results for later, explicitly says we still need more evidence,
Meaning?
meaning we need those long-term, properly randomized controlled trials to really confirm if laser is truly superior to conventional surgery across the board, especially regarding that long-term recurrence question. The jury's still out on the definitive long view.
A crucial point for ongoing research. Well, this has been incredibly insightful. This deep dive was based on that profound review by Dr. Reza Lankarani, who's an editorial board member of the Genesis Journal of Surgery and Medicine.
Indeed.
And if you want to dig into more details on this research, you can check out the Surgical Pioneering podcast series application. The link is surgicalpioneer.codeedx.me. That's surgicalpioneer.codeedx.me. Do you?